Hello and welcome to Medical Shorts by Tutor IMG. In this video, I'm going to tell you how to differentiate between bipolar 1 and bipolar 2 disorders. So the bipolar disorder are mental disorder that are characterized by extreme shift in moods. The patient is going to present with major depressive episode, mania and hypomania. Okay, mania or hypomania. So bipolar disorder are basically characterized by extreme shift in mood. The patient is going to present with a major depressive episode, mania or hypomania. So I'm going to draw a simple graph that will help you to differentiate between the bipolar 1 and bipolar 2 disorder. In bipolar 1 disorder, the patient is going to present with an episode of the mania that is accompanied by major depressive episode. Okay, that is the bipolar 1 disorder. Coming to bipolar 2 disorder, in bipolar 2 disorder, the patient is going to present with hypomanic episode that is accompanied by the major depressive episode. Okay, so the blue color is bipolar 2. For making the diagnosis of bipolar 1 disorder, we just required manic episode. The major depressive episode is not required for making the diagnosis. Although in majority of the patient, the manic episode is accompanied by major depressive episode, but for the diagnosis, we just required only manic episode. Bipolar 2 disorder, the patient should have hypomanic episode that is accompanied by major depressive episode. For making the diagnosis of bipolar 2, we required hypomanic plus major depressive episode. So coming to the treatment, so usually we treat the patients with antipsychotics, mood stabilizers. Depending on the severity of the symptoms, you can give the patient antidepressant in combination with antipsychotics as well. For short-term anxiety, you can use anxiolytic for the short-term use. Okay, for anxiety, you can use anxiolytics for the short period of time. Along with that, psychotherapy that is very effective. So if you like this video, kindly subscribe to this channel and thank you very much.